I thought nursing in America had the greatest job security. Turns out I was wrong. A new hire who was training with us today actually told me she was laid off from Providence, along with multiple other nurses and a couple pharmacists back in July. And what's wild to me is this is not the first story of layoffs I've heard happening in healthcare. It seems to be happening all over the country. And I'm really curious to know, why is this happening?
I'll tell you. But before that, hey beautiful people, welcome back to my YouTube channel. Thank you for stopping by all the time and supporting me on this channel. And all credit goes to the creators in these videos. So the reason behind these layoffs is quite complicated, okay? Rising hospital costs, changes in patient demand, and shifts in healthcare funding, which is the major issue. The big beautiful bill, all of these are putting pressure on administrators because rural hospitals, for example, are already stretched thin and they are vulnerable because even in large city hospitals they are cutting staff. And while all these decisions may be called, they might say it's necessary for financial stability, the ones that are paying the prices are the nurses and the doctors themselves. Let's see what the creators have to say.
I just got laid off. I was laid off from my outpatient job and I was working in a NICU follow-up clinic. I have never experienced something like this before. So I'm doing what any sane person would do, which is I'm eating French fries, waiting to go into Hobby Lobby. I will say I'm very thankful that I work per diem. I do have a second job that I'll just pick up a little bit more at. I don't have benefits through this job, so I'm not taking a hit as much as a lot of the other nurses are, but whoa. I have a lot of feelings about this. I think the biggest one I'm feeling though is disappointment and I'm a little bit angry. This is the first time where I have seen with my own eyes that we treat healthcare like a business. It sucks because at the end of the day, the people who are suffering this layoff the most isn't me. It's not the nurses, although yes, we are suffering. It's the kids. And that's what I'm having such a hard time understanding is, why are we doing this when we know the detrimental impact it's going to have on the patients who are the
These
children?
professionals are not just losing their jobs, they are losing the pride and purpose that come with caring for other people. Because many face the stress of finding new employment, even in a highly competitive field, retraining for other works, or even leaving healthcare entirely. Now, I mean, nurses and doctors who have been there for us during the worst times. Y'all remember COVID, right? I mean, who can't forget COVID? They are now struggling themselves. I mean, the legislation is meant to balance budgets, okay? But it has turned into a human crisis for those that should be supported because this impact extends far beyond individual workers. Fewer nurses and doctors means longer wait times, okay? It means reduced care. It means the hospital struggling to maintain quality, and communities, especially the rural and the underserved areas, can lose access to essential healthcare. In fact, they will lose access to essential healthcare. So this is not just about the numbers, it's about real people. It's about the safety of every patient. Like this nurse said, the safety of every patient that depends on them. Because across the United States, nurses, more of nurses, right, than doctors, are losing their jobs. The very people we rely on to care for us, they are losing their jobs. Hospitals are laying thousands of healthcare workers and even all those same professionals that risked their lives during the pandemic. I mean, they worked longer hours, they put their health at risk, they kept our communities healthy. Families are also facing uncertainty. I mean, bills do not wait. And the emotional toil of losing the work that they have dedicated their lives to. Guys, let me know your thoughts in the comments.
So, I am a doctor and I was just let go, and my chief said verbatim that it was directly due to the big beautiful bill, due to the prospective budget cuts, or to the budget cuts, the expected budget cuts to Medicare and Medicaid. So yeah, I feel very vulnerable right now. And it's like, I didn't know, it's like I didn't know it could happen to me until it happened to me. So yeah, Trump sucks. Yeah, but I'm gonna cry and then after that hopefully I'll be okay. But yeah, update.
So I got laid off today. I'm a registered nurse. I've been a registered nurse for 3 years. I've been a home health nurse for the past year. Alongside being a home health nurse, I've also been a healthcare coach remotely. A few weeks ago, I was laid off from my second job as a healthcare coach due to Medicaid cuts. Today, I was laid off from my agency due to my client being cut from Medicaid. Mind you, this is healthcare, one of the most lucrative, job secure fields that you could possibly have. And here we are having nurses and doctors being laid off left to right under this administration. And if you ask me, this is only the beginning. If we don't do something now, things are going to get worse after this. You have groceries increase, gas increase, bills increase, unemployment increase. This is crazy. This is crazy. And something really needs to be done.
Let me know what you think in the comment section. Because nurses and doctors, as we all know, are the backbone of healthcare in the United States, and I mean everywhere, right? They save lives, they care for the sick, they keep the community healthy. And yet, because of financial pressures caused by the big, beautiful bill, they are being laid off while hospitals are struggling to financially stabilize or financially stay afloat. It's unfair and it's unjust. That's what I think. And these professionals should not be the ones paying the price. Protecting and supporting them is very, very essential, not just for their livelihood, but for the safety and health of every patient in America. Nurses and doctors have been there for us in our most critical moments, in the moments where we all felt as if we were going to be unalived. Because now is the time to be there for them. I mean, they deserve all the care and attention in the world. They deserve security, they deserve respect, they deserve support, and they don't deserve layoffs caused by policies that they had no role in creating. Because communities across the country will feel the consequences too. Hospitals with fewer staff cannot provide the same level of care. Emergency rooms will face longer wait times, and even patients in rural and undeserved areas might lose access to essential services entirely. So the system is being strained at the moment. We rely on it the most. Now, the big beautiful bill may have been intended to manage budgets, but it has created a situation where the people that keep the healthcare running, I mean, the very ones that we trust with our lives, are bearing the brunt of the consequences. So now this raises a very, very important question that we need to ask ourselves. Why should those that dedicate their lives to others, okay, be the ones facing layoffs, facing instability? Because these people deserve protection, they deserve support, they deserve recognition, and they deserve policies that strengthens the healthcare system rather than weaken it. Because when healthcare professionals are forced out of their jobs, because I mean, it just discourages future generations from also entering into the field. Fewer trained nurses and doctors in the incoming years could leave the United States and leave us unprepared for the next health crisis, because we actually don't know what can happen tomorrow. So supporting healthcare workers now is not just a matter of, okay, let's be fair. I mean, it's going to benefit all of us. It's a matter of public safety and long-term health for our nation. So I just feel that it's time to take a stand. Hospitals, policymakers, communities, we should work together to ensure that, okay, nurses and doctors are valued, protected, because they don't, many of them are living every day with the fear of, oh, am I going to be fired today? I don't know what my manager is going to say today. I don't know what the HR is going to give me today. It should not be so. They have cared for us in our most vulnerable state. They should not have to live with the fear of, okay, am I going to lose my job today because of decisions they have no control over. They don't have to face layoffs caused by a bill, caused by a budget. Guys, this is an investment. Investing in nurses and doctors is an investment, not just for us as individuals, but for us as a nation. Let me know your thoughts in the comments, and I'll see you in my next video. Please don't forget to like, share, and subscribe. Stay safe. Mental health is important. Ciao.